Hi, my name is Dr. Josh Strassberg and I'm a pediatric orthopedist here at the Pediatric Orthopedic Center. I'm very proud to be nominated as the New Jersey Monthly Top Doctor by my colleagues for the 9th straight year. I've been in practice in pediatric orthopedics in New Jersey since 2007. I was very happy to come back home since I grew up locally. Coming back home has allowed me to have the joy of being able to see the children of many of the people that I grew up with and went to school with. I specialize in pediatric sports and trauma injuries as well as hip disorders. Before returning to Jersey, I had the privilege of training under some of the top minds in the world of pediatric orthopedics at Boston Children's Hospital as well as the Children's Hospital of Philadelphia. I was then able to bring all of that expertise back here to New Jersey. My goal is to treat my patients as if they were my own children and to work with parents the same way that I would expect my children's doctors to work with me. I feel it's important for my patients and their families to have a full understanding of what I believe is going on with them and what I think is the best way of treating their issue. This way, they can make an informed decision. I think that patients and parents are much happier and feel much more comfortable with their decisions when they understand what's going on. People often forget to recognize that children are not small adults. The treatment options for children can be very different than in adults. In pediatric orthopedics, we deal with a wide range of patients starting from newborns up until they're young adults, which gives us a much more varied population than in many of the other orthopedic subspecialties. This variety is a part of what actually makes pediatric orthopedics exciting and enjoyable for me. Because children are good healers and tend to bounce back more quickly than adults, it often allows us to be able to be less aggressive and less surgically oriented when caring for our patients. With youth, however, also comes more complexities. Since children are still growing, there's a risk of causing damage to their growth plates, which can have a devastating effect on how they grow. And the treatments for various issues are not typically one size fits all. What may work for a 2-year-old may not work for a 10-year-old, and how I treat a 9-year-old for an injury can be very different than how I would treat a 17-year-old for that same injury. Because of this, my patients may require different techniques or instruments to accomplish the same goal. My practice offers the latest treatments to optimize your child's care. Though I'm trained as an orthopedic surgeon, I know that surgery is not always the first or even the best option. When treating my patients, I want to achieve the best outcomes with the safest and least invasive means necessary. I'm a father of 2 boys, and I always make sure that I give the same recommendations to my patients that I would make for my own children. I know that in order to be a great doctor, you can't do it alone. You need to have a great team alongside you. When you're injured or you're in pain, especially as a younger child, it can be scary to go to the doctor. I have the advantage of having a staff that is wonderful when it comes to making our patients feel more comfortable and less scared when being treated. I also have the benefit of working alongside some of the top pediatric orthopedists in the area. There's often more than one way to treat a problem, and having my colleagues close by can sometimes allow me to get different perspectives when handling a different case. I have to say that my favorite part of being a pediatric orthopedist is getting my patients better, seeing them thrive, and knowing that I helped to get them there.